All right, everyone. Hope everyone's doing well. So are we surviving? We're now into week 3, which is crazy. A lot of you have sent me your topics. I'm loving the topic choices that you guys are having. I've actually had some great discussions with some of you about your topics, and that actually makes me pretty excited because you want to make sure that it is a good topic and just figuring out what fits best with your future profession as well with your passions. I love that. Some of you guys are coming up with some really cool ones and it makes me really excited. So whenever I get to read all of your reports, I know that I'm going to be learning from you guys as well. There's a lot of research out there. And so it's kind of cool whenever some of you guys go through there and I'm like, oh, I didn't even catch that one. Or if something of that nature. And if I find one that as I kind of read through your, because believe it or not, there's like 30 of y'all, but I read every single one. And if I find something like interesting, then I'm like, oh, you found this awesome article, I might share it with everybody. I won't like read out your report. However, I will be like, hey, so one of our students found an awesome report or an awesome research article. Let's dive into this. Because chances are some of the research that you guys are going to be digging into will pertain to one of our subjects. So yeah, I'm pretty excited. A lot of you, there's a couple of soccer coaches that we have on here, so they're kind of narrowing in on different entries maybe that they see or something like that. Some of you, I know somebody's been in band, which I'm a fan. That's pretty cool. She's going to kind of tackle that subject, looking at common injuries and stuff. So having that conversation with her is kind of fun. I'm trying to think of some other ones. Some people are looking into dance. Some people are looking into CrossFit or powerlifting. There's just a wide range of things you guys can get into. And if we end up running into the problem of, okay, I can't find enough research to fill these 5 journal entries, then don't worry. Let me know. We'll kind of expand it or shift it a little bit just to kind of see what else we could piece in. Because you can always, that fluid topic is there. We can kind of be like, okay, this is relatable. Let's see how we can piece this into a research paper as well. So we got a little bit of flexibility there. All right. So today's topic is just bones of the human body. It's very general. Basically, we're just going to chat about the different features or noticeable things that we want to point out about the bones themselves. And a lot of that just goes back to anatomy, sort of your human anatomy class, where you get to basically memorize a buttload of terms. And I'm sorry, not sorry, that's what all of us have to do. And it's just, I used to make flashcards of these bad boys, and until I was blue in the face, just start flipping through them. And so as we go through those, you'll kind of see what I'm talking about. I've only picked out just a handful of those different features that you're going to have to learn later on in anatomy. That way, at least you can start getting familiar with them so that you're not overwhelmed whenever you do take a human anatomy course and there's like a whole freaking chart of them. But at least this kind of just gets you familiar so that later on you're already a step ahead of everyone else. So volume is extremely low. Can't hear anything. Sorry. Okay, is that better? Let's see if it's on my end. And if I need to, I can take off these headphones.
It was my fault. My computer was connected to my sound bar somehow. Sorry.
No, you're fine. Okay. Everybody else hear me okay? Okay. Awesome. Okay, everyone. Looks like a couple more have joined in. So let's go ahead and get started. So as we go through this, and it was funny, I was flipping through some of the material beforehand here, and it's always funny because this is one of those where it's not exactly the most thrilling topic, but it does get our feet wet. Words are hard today. It does get our feet wet, just in case you've never taken anatomy. So that way, as we move through this class, it's not like you're deer in the headlights. Oh my goodness, what is this? Gives you a little bit more information. Okay, sorry, it's not working. Bear with me here, technology. There it is. All right, everybody see it? Okay, so if you have a question, I can't see any of you, so please just put it in the chat box as we go through here, or better yet, just, unmute yourself, say something. So talking about the bones of the human skeleton, there's, just as an overview of the skeleton, we have about 206 bones in the human body. Some people tell you more, some people will tell you less. 80 in the axial, 126 in the appendicular. Of course, we know the head, neck, and trunk make up that axial that we talked about. Appendicular are the upper and lower extremities. And if you recall, the functions of the bone supports body tissues, provides for leverage for those movements that we have, provides protection for the bodily tissues. So, especially the ribs, that's what really comes into play whenever we're protecting our vital organs. And then a big one for me is provides a storage of minerals. Now, bony terms, this is basically, if you think about it, it's just features that we find throughout the body on bones, okay? So a lot of them you'll find in many different places. It doesn't have to be just the picture that I showed you. It could be many other locations. But let's just start it off with an easy one. So condyle, it's a large rounded articular process. So there's not much else that I can say about that except for the fact that if you think on your knee, how there's that rounded, does everybody see what I'm pointing to right here, hopefully? There's that nice rounded articular with the basin at the bottom. Well, that nice rounded articular at the top is what is the condyle, and that's usually capped with a nice hyaline cartilage, and then the meniscus is in between the femur and the tibia. But you'll find them throughout the body. Here we have a nice little weird skeleton. This looks like an animal. And you can even see the rounded articular processes right here at the base of that skull. Next up, so this one might go really fast today, guys. Chapter 4 is kind of one of those that you just got to memorize all the vocabulary and have fun with that. Foramen, an opening through the hole. So whenever you have, there's different spots in the body. Big one that you'll see is in the pelvis. But basically there's going to be little bitty holes or bigger holes where things pass through. Usually it's an artery, vein, nerve. But this little guy right here, do you see it on the jaw? Right there, yeah? That little guy right there is a foramen. So you're gonna see these all over. You'll see them again, especially whenever you get into human anatomy. They're usually just a circular hole and things pass through them. So a fossa. So these guys are broad, shallow, depressed areas. I always associate it with the scapula because right here you see this subfossa right here. So this is the underneath side of your scapula. And basically, if you think about it this way, it's a depressed area where usually a muscle sits. Like right here, that's where our subscap would sit. Over here, infraspinatus would sit right there. Also on top of here, supraspinatus would sit. So it's just, think of whatever terms or associations you want to get to memorize that. I forget mine. I think it was like a desert, something like that. I somehow paired that in with fossa. I don't know. But whatever works, the shallow depressed area is a fossa. It was probably depressed desert was what got me. I don't know. Just think of something on your own, some way to memorize that, and it'll help you out later on in human anatomy. Let's let a few more people in here. Okay. So next up, a process. So a process, my fancy term for that is a sticky outy thingy, and it's a relatively large projection. So I don't know why, but especially in other classes, this kind of stuck with a lot of them. And a process, basically, anytime that you see it in the body, it's sticking out. So it's a large sticky outy thingy. And here we see on our scapulae, we see the coracoid process. It's a big one that sticks out. As well as over here in the hand, it's a little bit littler, obviously, compared to our shoulder, but the styloid process is right there. You'll find these throughout the body, and I'll point them out as we go, but those are two key ones that you can kind of identify right off. And usually you can palpate it on yourself as well. Any questions as we go? make sure that is everybody muted? Okay, gotcha. All right, so Remus. So with these guys, it's an arm-like branch off the body of a bone. So whatever you want to think about, again, to kind of associate this, a ram has a lot of horns, so whatever you got, I don't care. But again, getting that association of the term and then with something that kind of helps you remember, it does help whenever you get numerous of these bad boys. But as we can see with this, we have a nice little ramus that sticks off of the body of a bone. And I need to replace this with another one because I like the other picture better, but they're seen throughout the body, but mainly in the pelvis is a big one. All right, next up, sesamoid. These guys are fun. So they're an irregularly shaped bone inside a tendon for the purpose of providing fulcrum advantage. So the biggest one that everybody thinks about is the patella. Because if you think about that patella, it's kind of funky looking, A. And really the only thing that's holding it in that groove that it sits in are two tendons. And of course you have a bunch of muscles and fascia that are pulling on said sesamoid, but still it's basically floating around there inside of a tendon. That being said, that's why we see a lot of, your patellar dislocations, or maybe the patellar tendonitis or runner's knee, just because it is not really attached to anything else. It's floating in that space, housed inside a tendon. And especially whenever we talk about things like plica. So plica syndrome is where there's little bitty filaments in the knee and they can kind of get pinched and snapped and inflamed. Some people have to have them taken out. I was a lucky winner of that. And things like the plica and the fascia, they can actually get inflamed in that area whenever this bone is floating around all over the place and doesn't really have a lot of control and stability there. So we want to have good quad muscles, good hamstring muscles to really support that area. That way, not a lot of tension is being placed in the tendon, which again, runner's knee, we see that a lot, or jumper's knee. And so with this nice little floating bone that we see in here, can anybody think of another sesamoid in the body? So whenever you think of a floating bone or something that is inside a tendon, can anybody think of another one? So just think about all the different beautiful bones in your body. I'll wait.
Your jawbone?
Close, like what you're thinking. So this guy does have a joint right here. Definitely not housed within. However, think a little bit lower. Is there something that's right here that's a bone? We'll talk about it here in a second.
The trachea.
The trachea is in there, yes, sir.
Nice.
But you also have the hyoid that's in there. So some people refer to that as a sesamoid as well. We'll talk about that one in a little bit because I think that the hyoid's kind of cool. Some chiropractors, so if you're a future chiropractor, physical therapist, or athletic trainer, any of the above, there's a lot of great research and great professionals out there. The first one that comes to mind is Dr. Perry. He talks a lot about the hyoid and the different, pulls and different fascial connections that is made to the hyoid and how it can affect the entire body. So it's kind of a weird, funky bone that has a lot of potential. Let's move on. So spine, don't overthink it. Spine is just a relatively long, thin projection or bump. So it basically, the biggest one that you can think of, and you can palpate it yourself, is at the top of your shoulder up here. You kind of have that dip off. Maybe you have some tender spots in that trap up top, but then you can kind of palpate and you find that there's a spine or a bone that's kind of long that kind of heads out from the midline towards the outside, towards the lateral portion of your body. And there's a bunch of different muscles that attach in here. And if you see this bad boy right here, here's our spine right here. You can kind of see how there's the infraspinatus that attaches right here, supra attaches right here, and all these different red markings right there are where things attach in on that spine. So it's a great place to house that. However, it can be susceptible to, say, if football or something like that, if they're practicing without pads, can get a little bump and have some bruising there, just depending on how beefy the person is. Thinking about cheerleaders, especially, because usually they're not beefy. So say they accidentally get dropped. Does happen. Ow. But you will sometimes see some bruising along that spine just because it's usually a little bit closer towards it's a little bit more superficial. All right, so sutures. So has anybody here heard of craniosacral therapy? If you have, you've probably, maybe you've had it done to you. That is where some brilliant therapists are actually doing different pressure and doing different techniques and placing tension and pressure along these different sutures in your head, in your skull. And it has to do with, I have a beautiful friend who she's actually practiced on me and I've practiced on her, and she was telling me all about, you know, how it affects the different fluid that surrounds the brain and that surrounds the skull, and then also up and down our spine. So their kind of science behind it is that helping to unlock the tension spots in these sutures and in the skull itself, it helps to basically equal out everything throughout the spine and in the fluid that is housed there. There's a lot of other stuff that it also does, but that is one of the biggies. A lot of people think it's a little woo-woo, which, I mean, I completely understand. I think the more that we kind of look into it, the more that we find there are some more scientific principles that we can pull out. But no matter what, a lot of people, they find relief from it. So whether it's placebo or not, at least it does help people everywhere. So again, sutures, they are found in usually the skull, and there's nothing that's connecting to them. They're just fusing together, okay? And if you think about this, sutures are what are formed whenever our beautiful babies kind of have their lovely little noggins starting to kind of connect. Instead of being all squishy, those beautiful bones start to fuse together, okay? Any questions about that? Alrighty, so we're gonna dive into the 3 T's. These I always recommend students kind of write down on note cards, or just in your mind try to find a way to remember the differences between these, because even if I do believe that there's a question on the exam from me, but if there's not from me, there will definitely be several in your human anatomy course. So just get ready for it, start to get this into your mind now. A tubercle, so it's a smaller bump with a roughened surface, okay? I'm gonna go through all of these and then we can swing back around if we want. Biggest one is found underneath. Next one is a tuberosity. It's a large bump with a roughened surface. So this guy right here is our beautiful shoulder, or I should say the humerus going into the shoulder. And the tuberosity is there right here. Last but not least is a trochanter. So now we're an exceedingly large bump with a roughened surface. So basically they're all bumps with roughened surfaces, but it's just how big is that bump. So the trochanter right here, we see the femur. And so if you want to palpate on either side of your hip bones, there's usually that sticky outy thingy on the side. It's nice and big. It's usually a bone, especially if you're thinner or a little bit more bony. You can kind of feel it there on the sides. It's a great landmark for any sort of special test that you might do in the future. But let's back up. So we got tubercle. It's a smaller bump, okay? So here's how I think about it. You guys can think about it however you want to get this stuck in your brain. But tubercle, it's a little bit of a smaller word, okay? Compared to tuberosity, it's a little bit bigger. Well, guess what? It's a little bit of a bigger bump. It's a large bump. And then we get into trochanter, and to me that's just a bigger, like it takes a little bit more effort to say that word. And so to me that's a bigger word, which is the biggest word, and it says an exceedingly large bump. So that's how I think of it. However you want to get there, it's fine by me, but you will see these guys again, so learn it, live it, love it. And truthfully, sometimes I have to think about it. I'm like, okay, which one is it? And then I literally go through my little list, and that helps me out. So don't forget your diagrams. They are due the 22nd, which will be coming up faster than you think. here is the link just in case you needed that to fill it out. I've gotten several from y'all, but just wanted to give you it just in case. All right, so let's just kind of walk through different bones. Some of them you can palpate, some of them are too deep. Usually I have a lovely Mr. Bones with me to where I can just point out. Sadly, I don't. The best that I have is a pelvis, just because I do a lot of lectures with my women and workshops and stuff, so I use my pelvis a lot. But sorry, don't have a Mr. Bones. My friend does, so I might steal hers, and maybe that'll be here for next time that we chat. But axial skeleton, remember it refers to the head, neck, and trunk. So whenever we're talking about that, we're talking about the cranium, the face, ears, and hyoid. And then we have the neck and trunk. So we have the spinal column down the back, the sternum here in front, and then the ribs that envelop the side, okay? So the sternum and ribs, spinal column running all the way down, okay? Again, this is just a brief little overview, just in case, especially if you have not had anatomy. I don't want you going into this deer in the headlights blind, okay? Appendicular skeleton. So this has to do with, if you remember correctly, basically everything that's not red. Upper extremity, so we have the shoulder girdle, which is comprised of the clavicle, scapulae, and humerus. So if you think about it right here, and if I could turn them around, I would, but right here, all of these guys that come into play makes for a complicated joint structure, makes for a complicated, highly susceptible to injury structure. But it is what it is. So next up we have the radius, ulna, carpals, metacarpals, and phalanges. So let's work our way down. Does anybody know what the radius, like which side the radius is on if we're in an anatomical position? So I don't know if y'all can see me, but say we are in this lovely anatomical position, palms facing forward, kind of lower down, and my palms are facing forward. Everything's facing forward. Which one is on the thumb side? The ulna or the
radius? Is radius on the thumb side?
So yes. So the good way to think about it, y'all are exactly right. You have the radius and ulna. I think of it this way. The ulna is under. The ulna is under. So if you are in an anatomical position and you were to go like this, the ulna is under. That helps you guys, great. If it doesn't, that's fine too. But kind of just gives you a little bit of frame of reference. Carpals, those guys are in your hand. They sit about right here. So you have your wrist, you know, where the radius and ulna come in, and then they attach or rest on with some tendons and structural ligaments into your carpals. They sit right here. There's a buttload of them, and there's a bunch of dirty acronyms that you will learn in human anatomy, so I won't teach you those now, but that's how you will learn the carpals. And they go kind of, you kind of start counting them this way, and then you come back around towards the thumb. I think it's straight line to pinky. Here comes the thumb, is the clean version. So yeah, the other ones, I'll just leave that for you to find. But they're numerous throughout the wrist and then also in the feet, which we'll get to in a second. Then you got the metacarpals, okay? So you have these carpals that can feed in here. The metacarpals, cha, and phalanges, cha, all the way out. Now, we can kind of break those down into, you know, dips and pips, but you'll do that in your human anatomy. This is just the general gist, okay? So a lot of people, especially hands and feet, we don't really think about them until they get hurt. But there's a lot of bones in your hands and feet. So whenever you do injure those, you know it, and you kind of get familiar with those areas. All right, any questions about that? Oh, beautiful, lower extremity. So for our soccer people, this will be fun. I'm kind of in love with the pelvis and ribs. But the lower extremity, the pelvis, is comprised of the ilium, ischium, and pubis. So in the pelvis, which I should go grab mine here in a second. I'll probably have it for our pelvis chat. But you see it right here in our little Mr. Bones picture. With this guy, you have, you know, your sit bones down here that you kind of sit on. You kind of feel the bony prominence there. the pubis, and then the iliums. And we'll kind of break it down, but we have to kind of break those down into 3 just because they do fuse in together and they're seen as a unit per se. We'll chat more about that later. I'll be able to nerd that out about that later. Femur, so this bad boy right here. Chia. Patella, remember we already talked about that, was our sesamoid, right? All right, now let's talk about the tibia and fibula. Which one's where? So we have 2 bones in the lower leg, just like we had 2 bones in the lower arm. Which one's the tibia? Which one's the fibula? Is the tibia the big guy or the little guy? Anybody know?
Tibia is the big one, I believe.
Yes, right on. Good job. So the tibia, and then my anatomy professor, he'd be like, fibula, and then annoying little voice just stuck with me, you know, throughout the rest of my educational career and onward. So if you think about that, he would be like, the tibia is the big proud one, and then fibula is the little guy on the side, okay? And then we have the tarsals. So instead of us calling them carpals, which are in the wrist, right? The tarsals are in the foot, okay? Same thing, you'll learn them later. But then they connect into the metatarsals, which lead into the phalanges, just like we did in our hands, okay? Let's talk about that hyoid. So the hyoid is a free floating bone in the neck. It's not really connected in by, you know, like in the midst of a tendon, like say a specific sesamoid would be. That's what kind of makes it special, right? It's very special. Yes, ligaments and tendons do hold it in place, but if you look at this bad boy right here, so down here, you guys should see my cursor kind of floating around. See how a buttload of muscles attach into that bad boy? Yeah. So yes, sure, it's held in place by the ligaments and tendons, but not really, because you got a bunch of muscles going on in there. So think about it, if one of these guys, which there's a lot of little ones. I was just watching a lecture the other day where he was breaking down all the muscles, and I'd forgotten that there were so many little bitty ones in here, but you'll learn them later. But there are a lot of little bitty ones right here underneath your chin, okay? So right here, that kind of connect down into that hyoid. And then of course you got some coming up here. So think about in our culture, especially now with COVID, we're on our computers a lot, we're on our screens. So if we don't have it optimally positioned, we might find ourselves doing this all the time. Or if you're like me and you're texting or you're doing business on your phone, you're right here in front of you, okay? So you can imagine what tension and what tightness that can create right here in the front, okay? Also think about it, say if you had your screen a little bit towards the left or right, and then it started to kind of pull your head and neck this way, so there was a little bit more contraction on one side versus the other. I say all that to say this hyoid, it's just floating around in there. It has the ligaments and tendons to hold it in place, but all of those ligaments and tendons have feed-ins to muscles. And so once you talk about all the different shortened muscles versus lengthened muscles versus stretched muscles, tight, weak, whatever you want to call them, you can see where that hyoid can kind of get jacked up quick. So that's kind of the principle of many schools of thought on the hyoid that you will learn later on in your fun, long career, okay? I'm still learning about it, if that helps. I'm always amazed. So it's about the approximate level of C3. So as we're counting down from our spine, it's about C3 level. Third one down, if you want to think of it that way. Provides fulcrum for the tongue and neck muscles that act in swallowing and elevation of the larynx doing speech and swallowing. So again, it has a lot to do with the upper, let's just call it right here, of our esophagus into head and neck throat area, okay? So say if somebody has been having a lot of, what was he talking about? Acid reflux, or maybe a singer has been having issues. That's something that they would look at. So if you're talking about a musician or somebody like that, maybe a violinist, she has her crook neck where her instrument lies. A lot of times they'll be playing with hyoid there as well as other muscles, don't get me wrong, but there can be a play as that. Also, you know, professional speakers, singers, actresses, sometimes the muscles that are supporting the hyoid can be either overworked or sprained, or maybe the hyoid is just out of place a little bit, so it's putting strain on those said muscles. A lot of fun stuff can happen. So it's an interesting muscle, but, and you'll learn more about that later, I'm sure. Here's a side view for you guys, and you can really just see how it is floating. I mean, you see the bones here of our spine, right, the vertebra. And then here's this little guy right out here, just hanging out. Beautiful. All right, so let's chat about that spine, shall we? Any questions? Can't really see you, so just unmute yourself if you can, if you do have one. All right, so we divide the spine into 5 distinct sections. Usually, you know, in...
Actually, I have one question. Will we have any like flashcards on these, or like notes that we'll, like key terms really that we may need for these on the test?
Great question. So I let you guys make your own note cards because that's how you, I cannot do that for you because in anatomy, you got to write it out. That will help put input into your brain. And then you can burn them later. My feelings will not be hurt. I did that with mine. As far as the study guide or things of that nature, we will do a review before our exam. Now, since we aren't in person, it's going to be a tad different, right? Because honor system, y'all are doing this on your own, hopefully not paired up or anything stupid like that. We have software for that, so don't be stupid. But we'll do the review, and I'll kind of even have that exam pulled up, and we'll go through, okay, make sure that you guys take a look at this. Okay, make sure that you guys take a look at this. I won't tell you every single thing on the exam, but I'll pretty much give you a roadmap on what you need to key on. And then you guys will be responsible of writing that down, taking notes as you want, and then go from there studying on the exam. Okay.
So would you recommend like making a list of all of these definitions and what they are, and just kind of like starting to practice those heavily now? Or
yeah, I mean, in reality, so I'll be honest with you guys, whenever I took this course way back when, I was also taking a human anatomy course. So it's almost like doubling up, okay? It was kind of cheating, but not really, because it helped me a lot. However, I will say that the note cards and the study guides that I made for this exam, or these exams, this class, actually helped me with my human anatomy. So some of the ones that you make for this class, you might use in your human anatomy if you're taking that later. Just something to keep in mind before you burn them. And also, I mean, if that's how you learn, then please, by all means, go and start it now. Last thing that I want you to do is scramble last minute, okay? So it's really up to you and your learning style. Any other questions? Good question. All right, let's chat about the spine. So we have the cervical spine, thoracic spine, lumbar, sacrum, and coccyx. Now, in traditional kind of in our brains, we usually focus on C, T, and L. So the 3 big guys at the top of our spine. Not so much the sacrum and coccyx. In fact, we kind of tend to just lump those together and be like the sacrum, right? We might have been hearing about the tailbone, but a lot of us, even whenever we hear the tailbone, we kind of still think that whole lump at the end of the body or at the end of the spine. It's not so much, but we'll break that down a little bit more. We'll actually have a whole lecture over the spine. But just to get us familiar, cervical spine, there's 7 of them, okay? The T-spine, we have 12. Lumbar, we have 5. Sacrum, so it's this bad boy right down here. It actually has 5 vertebrae that are fused together. So lo and behold, these guys used to be floating around nice and pretty, and then they settled in. And then you have a coccyx, which is actually 4 fused vertebrae, which is kind of amazing whenever you look down at this bad boy because it's really, really tiny. But it does actually have a big play in with the pelvic floor and pelvis in general. And if you've ever broken your tailbone, you know how bad it can hurt and do things to your body. Now let's talk about how to remember these guys, at least for the top 3, 7, 12, and 5. Think about breakfast, dinner, lunch. Maybe you're like a late riser and you're like 7 o'clock. But if you think about it, if you're going to work at 8, maybe you're having breakfast at 7, dinner at noon, lunch at noon, and dinner at 5. Okay. So if that helps you guys, great. The vertebra is singular, vertebrae is plural. So whenever we kind of break that down, people can get really picky, and especially whenever you're talking to a professional, being able to distinguish between the two is a good idea. Again, we will break this down even further. The spine is a beautiful piece of machinery, and we have all these beautiful curves for a reason, and we'll talk about that as well. But for now, just kind of get this in your mind of 7, 12, 5, 5, 4. Okay. Now, I should, because you can never say always in the human body. I should just say that you will not always have 12 vertebrae in the T-spine, or always have 5 vertebrae in the lumbar, or always have 7 in the cervical, because each one of our beautiful bodies is different. And I have met people who are missing lumbar spines. And you talk about playing with a practitioner and you're like palpating and you're like, gosh darn it, I like counted this 14 times. Am I like blind? Am I missing something? It'll mess with you. But whenever you start to break down what the vertebra actually look like, which we'll do later, you can kind of start to distinguish with your palpation skills or on an x-ray, but you might someday encounter in your profession, in your practice, wherever you might be in the world, where you find somebody who is missing a vertebra or who has maybe 2 fused or something of that nature without surgery. So maybe an extra one's in there. And then you have to kind of figure out how that is changing their mechanics, because it will, because the body's just kind of set up that way. And so whenever you throw in some odd little oddities into that spine, it does make for an interesting case. All right, so let's talk about those lovely little curvatures in our spine. This is a little bit more the applied anatomy portion of this, okay? So as we were saying, we have 7, 12, and 5. That still holds true. But we have these curvatures in our spine, and this will make everybody kind of stand up straight, sit up straight. Kyphosis is a posterior curvature of the spine seen in this T-spine. So if you check out this guy right here, you see how there is that curve, right? So it's a posterior curvature. That means that the curvature is going towards the back, right? Then we have lordosis, which is an anterior curvature of the spine seen in C and L spine. So it's seen at the top and at the base, at the bottom, right before we go into the sacrum and coccyx, which you can even see that that makes another little curvature there. So these are natural curvatures that happen. We'll talk about later whenever you can have too much of a good thing, right? Even though we have these curvatures, sometimes we can have a little bit too much. Think about people with a sedentary job or lifestyle where they're on the computer all day. So they have an excessive cervical curve here. So that anterior curvature is a little bit more extensive and their bowling ball's a little bit further. Or they have excessive kyphosis, or they have what is called, what I call model butt, where they stick their butt out, and that lordosis is like amplified, right? So you can have too much of a good thing, but like this and how our body sits, where our bowling ball is stacked over our shoulders, ribs, and pelvis, it helps to disperse the load. It helps us prevent injury. And the physics and the structure biomechanics behind it is just amazing. But it's there for a reason. We just have to make sure that we don't have too much of a good thing whenever we're talking about injuries and stress in the human body. Scoliosis. So this is an abnormal curvature of the spine. So we just discussed 2 that were normal, right? Until they're too much, right? But scoliosis is something I actually have it myself. It's an abnormal lateral curvature of the spine that can manifest in any section of the cervical, T-spine, or L-spine. So this poor person right here has a very distinct and very prominent scoliosis. However, somebody like myself, or maybe some of you, might have a little bitty one. It might have been noticed whenever you were a small child. Maybe they didn't catch it until you were older. Is it the chicken or the egg, or excuse me, is it the chicken or the egg where you have like tight muscles have caused it, or is it structural to where like you were born that way and your spine is just abnormally curved naturally. And that's just what makes you you, right? Some people, they do have to have this corrected surgically. Some people, especially kiddos, they might put them in a back brace. Mine got caught too late, so they didn't really put me in a back brace, but I'm just thankful that it's not super bad to where I just make sure that I just try to stay strong. Sometimes it bugs me, sometimes it doesn't, especially during pregnancy. It can get kind of interesting, but a lot of people can do this. It can function normally and have a functional spine, core, and all those things, and have scoliosis. It's always good to know if you have it, because then you can educate your strength and conditioning coach, your athletic trainer, your physical therapist, your chiropractor, whoever you go to, that, hey, by the way, this is there. A great example personally was, I didn't even think about this, but I had to have an epidural late in my pregnancy, and I didn't even think about it, but the anesthesiologist, they put that lovely little spinal block in there in your spine, and the one where they wanted to put it was in obviously my L spine, but they couldn't get it to go through because of my scoliosis that is in my T spine, but it affects down below in my L spine as well. And so they actually had to go down one more step, one more vertebrae, just to get to get that epidural in. So knowing your own body is very important, because then you can help and share that knowledge with your practitioners or anybody that you're working with, because you can do different exercises to help with the stability, such as yoga or core strength and so much more, but it's always good to know. Okay, any questions on that? Alrighty, so let's talk about those beautiful vertebrae. So do you see these guys right here? See how they're different? What do we call these bones? So if we're classifying them in those 4 different classification categories that we talked about last time, if you remember them, they were long, short, flat, irregular. What were these bad boys? Does anybody remember? Don't tuck it once. So
Irregular.
yeah, thank you, Miss. So whenever we talk about these guys, obviously they're funky shaped, so they're irregular bones. But look at the differences. So right here, we have the C-spine vertebra. Right here, we have the T-spine. Right here, we have the L-spine. And as we go through here, breaking down the different terminologies that you need to be aware of, characteristics of the vertebra that you need to know, look at the differences between these guys, okay? So the body is the weight-bearing portion. So for our L spine, because it is at the base of our spine and has to take so much load, it's the biggest daddy on here, right? That body is pretty beefy, has a lot of surface, whereas up here, the C spine is just supporting our bowling ball, so it doesn't really need as much, okay? Transverse processes, the lateral protrusion of the cervical arch, vertebral arch that divides an arch into anterior and posterior portions. So think about this bad boy. You have those transverse processes that kind of divide the front half from the back half. Seen of all of them a little bit more pronounced in T-spine, L-spine. But I will be sending you guys, you won't necessarily need it for my exams, but later on, maybe it'll help you. I'll send you something that kind of labels out all of the vertebra for you. And then also something that I have pulled up here, hopefully, that gives you the lateral medial directions plus your planes of movement. So I'll try to send that to you after class. But it'll kind of lay out and describe all of these different processes and bodies and stuff like that on the different vertebra and have arrows pointing towards them, just to help you out. So spinous process. Do we remember what processes do? They sticky outy thingy, right? So it's the culmination of the 2 vertebral arches into one posterior process. So posterior, again, that means that it's going towards the back, right? So with the spinous process, that is what you feel whenever you maybe place your hand on your back and you feel those notches going down your spine. So this guy is right here that stick out towards the back. That's also what if, let's say I'm working with a patient, I kind of take 2 fingers and kind of see how we're looking, you know, down, just to feel where the spinous processes are. Because if I do feel one that's a little ticked left or right, I can kind of see, okay, is there any way that I can use some muscle energy or adjust to where it can get back into the center? Because yes, athletic trainers can adjust. And so we kind of check that out, play with those tissues, and see if we can get them realigned. It's one of the many things that we can use. So heads up there. Vertebral arch. So the right and left arch from the vertebral body, consisting of a pedicle and a lamina. So these two, know these two for the exam, hint, hint. It's a great word to be tested on, and I know the difference between the two, okay? So the portion between the arch and between the body and the transverse process, and then the portion of the arch between the transverse process and the spinous process. So basically they're the connectors, if you want to think of it that way, okay? So little bitty connectors. Little bitty connectors. Little bitty connectors. All right, so do you remember whenever we talked about the foramen being holes in the body, right? Seeing it through the bones, and then usually stuff passes through them? Okay, we're seeing them here. So the vertebral foramen, the big daddy between the posterior vertebral body and the arch. The vertebral canal, however, is the passageway that is created by each vertebrae's vertebral foramen. Excuse me. So let's chat about that. So the vertebral foramen, does anybody know which structure on here is a vertebral foramen just by reading the definition? Probably these guys, right?
The large one in the middle.
Yeah,
Exactly.
it's like in the middle.
Yeah, because remember we talked about stuff has to pass through them. They house stuff. These guys house very, very important structures in our body. And whenever they are misaligned and those bodies are not stacked up on, or those foramen are not stacked up appropriately, that's where we get some pain and discomfort many times. And then the canals. So that's actually seen between. They're littler guys. And again, I will send the arrows pointing to the structures so you guys have a better grasp and look at them as well. Facet. So a facet is a small flattened articular surface. Usually has a little bit of that hyaline cartilage sitting in there. And for example, I guess I'm right here. Here. So basically, I kind of think of them as like if you were to dip your finger in a sand, like just dip it in the sand and you just leave that little bitty indentation from your finger, that's kind of what a facet looks like. It's just like you just touched the bone and you left a little indentation in there. Usually that's where another bone will kind of fit in and articulate at that space, which is why you need that cartilage. But again, if you look at the vertebra itself, they're just usually seen as little bitty pads, like what you would see whenever you put your fingerprint in the sand. All right, let's talk about notches. So I wish that I had my vertebrae to stack on top of each other for you, but we're just gonna have to use our imagination, and whenever I send you that sheet, you'll be able to refer to that. So the inferior vertebral notch, the superiorly rounded notch in the inferior pedicle. Woo! So, and then let's talk about superior. So the superior vertebral notch, the inferiorly rounded notch in this superior pedicle. Woo! So let's talk about what that means. So whenever you look at these, this vertebra right here that we have on the side, imagine that you had two of those bad boys stacked one on top of each other. Like, I'm just going to skip to the next side real quick, like these, where they're stacked up. Here we have inferior and superior notches. Why are they inferior, superior whenever they're facing the other way? Well, it's the inferior portion of the vertebra itself. Here's the superior portion of the vertebra itself. It creates that superior aspect of the foramen, which kind of gets us a little bit confused sometimes. And then the superior actually creates the inferior portion of that foramen. But you have to think about it in terms of the vertebra itself, not in terms of the structure that it creates, okay? So about this foramen that these two structures actually create, the combination of the superior and inferior notches, which create a passageway for the nerve root. So these two little bitty notches are a big deal, especially whenever you're talking about, say, pinched nerve. Think about if we have a little bit of malalignment of some of those vertebra, or maybe slippage of disc or vertebra, which we'll talk about later. That can create a narrowing of that passageway, which again, pinches on that nerve, causes pain throughout the body. So they're little bitty notches, but they can cause a lot of concern. So let's break down a little bit more into the cervical vertebrae. Right, so the general characteristics that are good to know. There's a natural lordotic curve, okay? It has transverse foramen for those vertebral arteries, and then they get progressively larger in size as you go work your way from the head downwards, okay? Which kind of makes sense. And you'll see this as a theme throughout the body. As you stack, it gets bigger because you need a little bit more support to support the load above it and share that load. The C1, these are good to know, by the way, hint, hint. C1 is also called the atlas. C2 is called the axis. Let's have a chat. So you see that little dens that pops up right here? It inserts right here into this little beautiful facet right here and kind of pads up on it. And what that does is it kind of creates, and bear with me here a little bit, it kind of creates a little swivel for your atlas. So think about the axis that passes through a globe, how it helps it spin, right? So whenever we flick it around, the little kids, they go up to it and just start flicking it and flicking it, flicking it. Well, here we have that atlas that's poking up, resting on that facet, so that we can do the movements right here. And there's a beautiful little ligament that actually passes over that dens and connects to the atlas on each side to where it keeps that bad boy where it needs to be. So you can imagine if, say, your C1, C2 isn't stacked appropriately, which is why chiropractors and chiropractic care is so beautiful, as well as manual therapy. I don't pop C-spines. I do not adjust C-spines. I do more manual therapy interventions or refer out to a chiropractor, probably both, to be truthful. I'll have a professional who is amazing at it and does day in and day out. I've been taught it and I've done it before. I just feel like I feel like chiropractors are amazing at it, and I go to one who is amazing. And so I usually refer my patients to the ones that I know, and I have them go get their spine realigned by a chiropractor who does it every single day. And then I'm able to do the manual therapy to support that and keep it there, plus the exercises to back it up. Because a lot of times chiropractors, they don't have the time to do that. And I have a little bit more education in that area, so I can be a little bit more targeted. So as an athletic trainer, I actually refer out, and I'm a big advocate across the professions. When in doubt, just start referring out to different professionals, because you cannot do everything. Pick your poisons. So you can imagine what's going on with C1 and C2 whenever those are out of place and you can't properly do this or this, how that can affect throughout the spine. C2 through C6, those have bifid spinous processes. So bifid twos, right? We see this right here on C2. So instead of the pokey outy thing, the process being one, there's actually kind of splits off. And it's hard to feel whenever you kind of say you're poking around your spine right now, like on the back side. It's kind of hard to feel the distinction, but it is there, trust me. And then C7 has the largest spinous process. And that's because, which just, you're at home, nobody else can see you. If you kind of feel along your head and neck, you will find at the base of your neck and spine, there's a huge spinous process right there. And thank goodness there is, because I use that all the time as a landmark with my patients. It's literally one of the biggest largest spinous processes that we have. Okay, we only have a couple more. Hopefully I won't die, y'all. Sorry, my battery's getting low. But if I do cut off, just bear with me. I'll run and grab my charger and we'll be right back. So let's talk about the T-spine. Natural lake hypothesis. Oh, it's telling me to go grab it now. Okay, take 2 minutes, y'all. Sorry, my computer's about to die. So take 2 minutes, grab something to drink, do whatever you need to do. I'll be right back.